And now we're going to take a look at the global virus numbers. Coronavirus cases topped 1.4 million worldwide, and almost 83,000 people have died from the infection. The virus has been detected in at least 209 countries in every continent except Antarctica. The hardest hit areas right now are the United States, Spain, Italy, Germany, and France. And heading to the U.S., Americans are halfway through the toughest week of the outbreak so far, with the death toll nearly doubling in the first week of April alone. The number of deaths reached 12,900 as confirmed cases across the country approaches 400,000. COVID-19 has been detected in all 50 states, with an alarming cluster of cases swelling in the Northeast. New York remains the epicenter of the outbreak, with more than 142,000 cases, more than 5,000 deaths. New York City recorded more deaths from the virus than 9/11. Some good news. More than 22,500 Americans across the nation have recovered from the infection. over the past several weeks, we've learned a lot about COVID-19 together. We've seen this evolution of what the virus is, the damage it can cause, and what it's going to take to defeat it. So how much of this is just the disease spreading faster? How much of it is the government not being prepared? Joining us now to discuss this very thing is Seth Dinson. He's a healthcare analyst and author of The Cure, a blueprint for solving America's healthcare crisis. Seth, new CDC guidelines on self-isolation is supposed to come out today. Is our government doing enough to protect us? Or can you even prepare for something like this pandemic, COVID-19?
It's difficult to prepare for something like this. Listen, we have throughout the world literally hundreds of epidemics that occur in healthcare crises that occur every year. And so the ability to pinpoint one and aptly prepare is rather difficult. Now, listen, at the end of the day, it's relatively simple to Monday morning quarterback. And certainly we should learn from the things that we didn't prepare well on from this pandemic. But at the end of the day, I think the government is reacting responsibly when new information is provided and new processes come into play.
Yeah, and as it's being more transparent, we're seeing this play out for the doctors right there from our own homes. In fact, yesterday, New York Governor Cuomo, he said that the rate of hospitalization in the state was slowing down. Take a listen to this.
The 3-day average is down, which is good news. This is the 3-day hospitalization rate. We tend not to look at any one day. Day to day, it's up somewhat. But if you look at the 3-day average, it's moving down, which is good news.
Okay, so the rate of hospitalizations, that may be down, as he's pointing out. But yesterday, New York saw its highest single-day rise in deaths, I believe at 731. So what do we learn here, Seth, from the slowdown of hospitalizations alone? Is that significant, and why?
Well, I think it is significant because a couple of things that we need to consider. One is that we are now testing more, roughly 100,000 tests a day. Now, that being said, it's still not near where we need to be. But the fact that we're getting ahead of this with social distancing and people taking the right protocols and precautions means that our healthcare system isn't as taxed as it could be if this was more widespread. So, again, I know it's painful and the economic impact is great, but the social distancing is working, and it's allowing our healthcare system to react responsibly and effectively. And so kudos to the American people, but mostly kudos to our healthcare system workers who are working around the clock to protect us.
The president and the administration has sent in, as you're aware, of the naval ship, the Comfort, to arrive in New York at the Javits Center. These places weren't COVID merely a week ago. Now they're prepared to treat those with COVID-19. Why did we see this shift? Because we heard Governor Cuomo talk a little bit about this, Seth, and he says, look, we're not really seeing what we saw before with crime rates down, traffic accidents down. Now these centers are being COVID only. Kind of talk about that.
Well, I think the idea here is you got to understand that in a hospital situation, our healthcare system didn't just stop all the other things that it was working on. Nationally, our healthcare system is roughly 65 to 70% utilized for non-COVID situations. And so the ability for us to isolate COVID in certain areas, hospitals, Javits Center, wherever, and focus those areas on the treatment of that does two things. One, it allows our existing healthcare system them to continue to provide care to those that need it that aren't related to COVID, but also it allows us to contain the virus in a single area. Remember, hospitals is the biggest area where you can catch this if it is rampant.
Yeah, great point there. Seth Ditson, healthcare analyst and author of The Cure, a blueprint for solving America's healthcare crisis. Good to see you, Seth. Talk to you in a bit. Thanks for joining us.